morning, good afternoon, depending on where you are. Welcome everyone to our Academic Health Department or AHD webinar, the Public Health Camp, Building an Academic to Practice Pipeline at Public Health Seattle and King County. My name is Kathleen Amos, and I serve as the Director of Workforce Development at the Public Health Foundation. On behalf of our team, I wanted to thank you for joining us to talk about Academic Health Department partnerships today. We're really looking forward to hearing from the Public Health Seattle and King County team and from all of you as we discuss AHD partnerships. I just wanted to run through a few housekeeping items really quick before we get too far into the webinar. So audio is available today through either your computer speakers or phone. We just ask that you please keep yourself on mute when you're not speaking to reduce any background noise. Feel free to turn your video on. We love to see folks. And you feel free to put comments, questions, anything like that in the chat at any time. And to use the raise hand feature when we get to the discussion portion if you'd like to ask a question or make a comment out loud. Please also, if you have any technical difficulties with the webinar today, just send a note. You can send a note to the PHF webinars or just post publicly in the chat. And we'll take care of that. And then finally, we just wanted to let you know that the webinar is being recorded and we will be sharing it online following the events. So we'll just start off today but with a quick introduction to the Council on Linkages between academia and public health practice. The Council on Linkages is the group responsible for the Academic Health Department learning community. And it's a consensus-driven collaboration of 24 national public health practice and academic organizations that are engaged in efforts to improve the education, training, research, and practice of public health. Members of the Council on Linkages, as you can see on the slide here, span a variety of professional groups in public health, as well as federal agencies, the accrediting bodies for both health departments and academic public health, the certifying body, and the certifying body for public health professionals. And we at the PHF serve as the convener and provide staff support to that group. So we'll start off our presentation today with an overview of what an academic health department partnership is and how they might be useful. And we'd like to start all that with a quick definition. So throughout the webinar today, we'll be talking about partnerships that have been built between health departments and academic institutions or academic health department partnerships. These partnerships can take a variety of forms, but at their core, they are collaborative, mutually beneficial relationships that serve to strengthen and formalize collaboration. So we're looking at really moving the relationship between the organizations beyond working together, here and there because the people in charge happen to know and like each other, to making it more of a regular part of how the organizations operate and how they interact. These partnerships serve to strengthen connections between public health practice and academia, enhance capacity of the organizations involved, and further the pipeline into governmental public health. AHD partnerships can look quite different from one community to the next. There's no one right way to develop a partnership. But with that said, there are some basic characteristics that the Council on Linkages typically talks about as being part of an AHD partnership. At the most basic level, as we just mentioned, an AHD partnership has at least one academic institution and one health department working together. And as part of that working together, there may be some type of written agreement linking the organization. So this could be a contract, a memorandum of agreement, a memorandum of understanding, or something like that. Through the partnership, the organizations may engage collaboratively in providing education and training to students in the current workforce, work together on joint research projects, or jointly provide public health services. And this may involve the sharing of personnel, funding, or other resources between the organizations. AHD partnerships can strengthen connections between public health practice and academia. And then there are lots of reasons that organizations engage in these partnerships. So we've highlighted on this slide some of the more common ones that we hear from groups that are engaged in this work. AHD partnerships may help the organizations enhance capacity and better address community health needs. Provide students with more practice-based content, experiences, perspective through things like internships and practicums, or having health department staff provide guest lectures within the academic programs. And this in turn can help better prepare graduates for jobs in health departments. These partnerships can help with recruiting qualified personnel, particularly again in terms of that pathway from academia into governmental public health. Can facilitate lifelong learning for both practitioners and faculty members. It helps in the development and use of research that is relevant to practice. These partnerships often bring academic researchers closer to public health practice. They tend to emphasize more community-based research activities. They can maximize the use of limited resources, as well as enhance the organization's competitiveness for additional resources. They can help in meeting accreditation standards, both for health departments and for academic institutions. And ultimately, these all form a larger picture and help to strengthen the public health system and improve the public's health. So I also just want to say a couple words about the AHD learning community, which is an initiative of the Council on Linkages that aims to help support organizations working to develop and sustain AHD partnerships, providing an opportunity for people to explore the idea of AHD partnerships and learn from each other. So this community has been around since 2011. It's open to anyone who's interested. And we currently have more than 1,500 members from health departments, academic institutions, and other organizations across the country. The learning community offers a way for people to connect with others who are engaged in this work, as well as tools, resources, training, and technical assistance to organizations working to establish and grow AHD partnerships. Learning community activities include sharing stories and highlighting AHD partnerships, webinars featuring AHD partnerships like this one, developing resources such as a collection of agreements that organizations have used to formalize partnerships, and enabling dialogue and assistance. And all of these resources are freely available to anyone who would like to use them. So with that, I am going to have the pleasure of introducing today's speakers from Public Health Seattle and King County and their partner organizations. So we have joining us today, Shayla Holcomb, who's the Nursing Quality and Academic Practice Partnership Manager in the Office of the Director at Public Health Seattle and King County, a nursing leader, visionary, and project manager for the Public Health Camp 2023 and beyond. Shayla co-leads the Public Health Seattle and King County Education Engagement Strategy, creating and supporting nursing student placements in its health delivery system. We also have Greg Wilson, who is a program manager in the Environmental Health Services Division at Public Health Seattle and King County. Greg has been helping pave pathways for students, interns, and trainees for over 20 years. He has helped to lead the education engagement strategy at Public Health Seattle and King County. In addition, we have Betty Bekemeier, who is the director of the Northwest Center for Public Health Practice at the University of Washington School of Public Health and a professor at the University of Washington School of Nursing. Betty is a longstanding academic practice partner and strong nursing and public health leader. She helped support and make the Public Health Camp 2023 possible. And finally, we have Lynn Weintraub, who's a CPH major in the United States Army Nurse Corps. Lynn is a graduate student who helped to evaluate the pilot Public Health Camp to guide its further development and pave the way for future growth. And I have learned today that she has just received her doctoral degree. So please join me in welcoming our speakers, and I will turn things over to Greg, I believe, to get us started.
If you think you're beaten, you are. If you think you dare not, you don't. If you'd like to win but think you can't, it's almost a cinch you won't. If you think you'll lose, you've lost. For out in this world you'll find success begins with a fellow's will. It's all in the state of mind. If you think you're outclassed, you are. Got to think high to rise. You've got to be sure of yourself before you can ever win the prize, because you see, life's battles don't always go to the stronger or faster man. But sooner or later, the man who wins is the man or woman who thinks they can. And on behalf of the only Martin Luther King County in the country, it takes just pride for all of us to be a part of this coffee conversation today, to be able to reflect with the comments I shared. We're trying to convey were adventures and attitudes. How can we bring like-minded folks together to celebrate the adventures and attitudes by making a positive difference in the lives of others by meeting them where they are? And the education engagement troop, the strategy troop, is like-minded people who've come together internally throughout the Martin Luther King or Public Health Seattle and King County organization, but also under the academic health department model, connected externally as well with our stakeholders and academics, corporate foundations, etc., coming together. What we found is we all benefit from this opportunity to grow personally and professionally. And that's what we're focusing on for us as regards to the troop. We encountered some barriers in our policies and our structures that have, as we honor the past that were there, but we came together to help look at what we could do to create new working together platform. This became a platform for us to be able to help articulate what we can do to make magic happen. How can we help magic happen for ourselves and for others? The emphasis was focused on the students and creating a STEM environment, science, technology, engineering, arts, and mathematics we added to be able to focus on our career development. A lot of the students still felt that a mouse had four legs, and we felt it was a part of our opportunity to create the AHD model to come and help connect with them. So with that in mind, the target was to be able to show that we can help bring passion to the students. A lot of them didn't know they had, that we can help to look at career development so that they can have exposure with the STEM background. And from that, we were able to have coffee conversations to be able to generate some best practices and some lessons learned that we're looking to share with you today. So with that as the backdrop, we wanted to, before I make another statement, would like to say thank you to Ron and to Maria Flake and to Mayala and Kathleen. You all have been just wonderful partners for us to help launch this, the beginning of many more to come. And so with that as the backdrop, I'd like to turn it over to our academic partner from the University of Washington, which was huge in allowing us to be able to manage success. And with this, we will look to move to the future, moving from success to a new level of significance. And so with that, I'd like to turn it over to Betty. Dr. Betty Bekemeier, as I've learned and as I've gotten to know her, her middle name is Good Cookie. And I just want to share that with everyone to know that we're just happy to be a part of her space, and the essence of her is just really strong in supporting all of us. And so Betty, thank you very much for all that you've done and your team to help us be where we are today.
Thanks, Greg. So briefly, I'm just going to give a quick little backstory to how some of how we got here. So I wear a few different hats. I'm the director of the Northwest Center for Public Health Practice here at the University of Washington, but it's a very outward-facing unit of the UW that really works with practice and other academic partners in our whole region. And so, you know, we live and breathe that space of the sort of academic practice partnership piece. So going back several years, many years actually, we've long had, and the University of Washington has long had deep relationship with Public Health Seattle King County. Several years back, some years before COVID, we established MOU, and the Northwest Center for Public Health Practice helped steerhead, you know, this between Public Health Seattle King County. I'm faculty in the School of Nursing. I'm also faculty in the School of Public Health. So I'm this bridge between these schools and the health department as well. So there was a lot of interest in both schools, the School of Public Health and the School of Nursing, and being involved in this. And of folks at Public Health Seattle King County wanting to have both schools involved. So this is just a screenshot of page 1 of our MOU. It's several pages, and just for all of you out there, it's no small thing, strangely enough, if you're in this space, to really negotiate something between two different schools and a big health department. It shouldn't seem that difficult, but it's really something to get everybody on the same page. I see heads nodding. So it was a really fun and exciting experience to sort of land this MOU together that we've all agreed on together. And so in that space, we have this MOU that we're all agreed to and that we're all a part of, et cetera. And under that umbrella, and if you can go to the next slide, we've also got other things on our campus that we were able to leverage towards moving towards this public health camp we're going to talk about. And that is on the right here, you see our population health initiative. Our president is very, very engaged in and excited about population health, the president of the whole university. So she's obtained resources to really launch this population health initiative several years ago, long, well before COVID. And through that initiative, some years back, we were able, it provides funding as well. So we use that initiative as a means to propose, hey, could we hire a faculty devoted to working in this space with Public Health Seattle King County and the School of Nursing and the School of Public Health. And so thankfully we did that. We got funding for 4 years of support for this faculty. She came in, Jenna Van Dranen, as an assistant professor and has been deeply, deeply involved in working with Public Health Seattle King County and conducting research and doing evaluation activities and you working with students, growing student engagement with the health department, et cetera. So Jenna has been amazing. And then in conjunction with this, we also had Shayla, who was getting excited about this idea of a public health camp more recently around growing recruitment and retention among and bringing in new blood into the health department. And I'm also familiar with, we've had this long-standing nurse camp in the School of Nursing that works with high schools to bring students of, particularly students of color into healthcare careers, et cetera. And that's been super successful and really exciting. And when Shayla and I when we were talking about it, we were like, well, we've already got this model. And so we wrote a proposal again to this population health initiative, which helped kind of launch and seed this exciting opportunity that you're going to hear about, as well as leveraging this this fabulous resource we have of graduate students and you'll hear from Lynn, who got majorly involved in this and was a big piece. So I'm going to hand it off now and let you all take it away in terms of what emerged as a result.
Sorry, Shayla, you're muted. Yeah.
Shayla, you're unmuted, but we can't hear you.
Can you hear me now?
No, now we can.
Oh,
Yeah.
I just like to make an entrance. So, hi, thank you, everyone. And what a nice, teeing up for me to just share about this wonderful activity. So thank you, Greg, for opening this up, grounding us in so nicely about why we're here and where we've come with our education engagement strategies at Public Health Seattle and King County. And it's because of partners and leaders like Betty at the University of Washington that our idea of replicating a youth camp and career exploration activity like the UW's Nurse Camp became possible. And we took that concept of the UW Nurse Camp and we repackaged it for the vast career pathways in public health. As folks have mentioned, I'm Shayla Holcomb. I use she, her pronouns, and I help lead our nursing quality and academic practice partnerships at Public Health Seattle and King County. Pictured here are youth and staff from our first ever group of public health camp ambassadors. And also with them is our Seattle City Mayor, Bruce Harrell, and our Director of Public Health, Seattle and King County, Dr. Faisal Khan. During our very last afternoon of the camp, we hosted a fireside chat with these esteemed local leaders where they shared why they chose their job and the path they took to get there. Very inspiring. And to help tell this public health camp story, I'd like to share our vision and goals, who we've partnered with, and how we work together across our department to really build this capacity and engagement to make this possible. We'll touch on our planning process and the steps that we took to tackle and execute this pilot. And we'll wrap up with some of the most important aspects, our program evaluation, and really hearing from Lynn what her research and evaluation really yielded and what was the impact and learnings that this experience had on the young people. So the Education Engagement Strategy Troop, or you'll hear me refer to it as EES, developed this academic to practice pipeline activity with early engagement of high school students who may not otherwise be inclined to consider careers in public health. And we tackled this aim by partnering with the career and technical educators in our local school districts. We also attended local healthcare career fairs and community outreach events, as well as relying on word of mouth, very strong to carry our message of this opportunity. So keep it sharing. Thank you all. But in our county, youth furthest from opportunity live in our edges and in our northern and southern regions. So really those outskirts of the county. And so we really focused on targeted outreach to those areas. And we targeted our outreach to students interested in science, technology, engineering, arts, and math, with really that emphasis on health and sciences, right? Really trying to find those students that would really get excited about this opportunity. And our goals were simple. We wanted to allow staff to be themselves, immerse the learners in the work, really bringing them into where the work happens and having them engage in some of the hands-on learning that happens day to day with public health professionals. We utilized a low barrier entry method by just asking interested folks to share a little bit about themselves. We had them complete an electronic form. We collected some very basic demographic information. And really, we just wanted to know what interested them about camp and what makes them unique, what makes them them. So this interest form was open from March to July 1st. And we did that intentionally too, as far as bringing the open date almost clear up to the start of camp. So I just wanted to point that out, that we really wanted to make sure we left a big window. And I'd be remiss if I didn't mention the project team. So what you're looking at here is a network of interdisciplinary and cross-sector collaborators from public health, Seattle and King County, and a few of them outside of our county as well, or outside of our employer. And really what we did though is for our pilot year, we engaged public health staff, health industry leaders, folks that work in youth development services. And we really wanted to find those that were invested in our concept and idea and were willing to, jump in the pool with us and see what we could make out of it. So this list of professionals helped us extensively in our planning and execution. They served on work groups, committees, and really were there for our go live and day of operations. And just to share a small sampling of the role diversity that served on our panel, folks pictured here are social research scientists, our data gurus, our health educators, nurses, social workers, registered sanitarians, leaders, project program managers, just to name a few. And how we found this team is early on in our planning steps, we sent out an internal survey to our divisions, to our workforce members to see who had capacity and interest in helping us launch this, looking for those opportunities that really aligned with our foundational public health services and with our workforce engagement activities. This has really been complementary to our lines of business. And once we identified that team, we met regularly, about 1 to 2 hours a month, and a little more often, of course, as the date neared. But teams had their support of their supervisor. They did all this convening and collaborating on work time. And really, we pulled it off. We really mapped out who are our stakeholders, who are our partners, and who are those already doing this work, and how can we, again, pull on that same thread? Emphasizing on what helped to make this possible is our partners. So pictured here, and as Betty mentioned, the University of Washington offered that Population Health Initiative Fund that was able to really help bolster our first year. We received $25,000, and then our School of Public Health agreed to do match funds up to $15,000. So we got a total of $40,000 to pull off this activity. And it also included a enrichment stipend for the participants. So we did, as at the end of the experience, they came away with a little monetary enrichment stipend by way of gift card that they could use. So I want to talk just a little bit about our timeline. I'm going to do just a quick time check. Okay. The development and the evaluation of Public Health Camp has been guided by the pre-seed proceed model. And you'll hear more about that when Lynn dives into our process. But the pre-seed includes the planning and assessment phases, and the proceed follows the planning and assessment to include the implementation and the evaluation. So really looking at our process impacts and outcomes. And using this model, we co-created our outcomes here. So our co-created model is really defined by our inclusion of current college and high school student interns in both the planning and the evaluation. This has been pivotal to the execution of this offering. And really our goal is to design a scalable model, one that can allow for future growth and development, and really maybe building a program that can include other community health partners and other smaller community health clinics that may not otherwise have this reach that we can to expose interested folks to careers in community health and in population health. So I wanted to just, what better way to kind of share with you a little bit about what our day was like by with sharing a video. So if Mayala, could you help me cue up the video? And while you're doing that, I'll just give a little rendition of kind of how our days were spent. So we did a 3-day in our pilot year of camp. We did 3 days of camp, and this was just simply a day camp, no overnight, but a day camp opportunity. And on day 1, we really looked at, of course, establishing rapport, building relationships, and that introduction, grounding the youth into data. And then we went into a robust health foyer kind of tabling event. And then day 2, it started with our jail health team. We traveled to our downtown public health center, where at that clinic, folks who are served there primarily are experiencing homelessness. And we got to hear from our overdose prevention team and our youth tobacco, cannabis, and vaping programs on their work. And then our final day was full, highlighting topics from equity and social justice, One Health concepts, communicable disease and epidemiology, as well as visiting the City of Seattle's emergency response or incident command site. We ended with a fireside chat that I shared about in the very beginning with our pictures of our esteemed leaders. So with that, I think I'm wondering, are we having trouble with the video?
Can you see?
It's just coming through now.
I'm not hearing sound though.
The name of this is the Public Health Campus. That's the content. The context behind the Public Health Campus is THE, the human experience.
Understand that we are currently on the traditional land of the Coast Salish people.
We serve over 2 million people, and there's an additional 250,000 commuters that come through our county every day. We have 39 incorporated cities and over 2,000 square miles of land, which is the size of the state of Delaware. So that gives you some context, hopefully, about the size of our county. Our complexity and scale, we are the 10th largest health department in the entire US. We have 34 fire departments, 8 hazmat teams, 37 local law enforcement agencies, 20 acute care hospitals, over 7,000 medical professionals, and over 100 languages are spoken throughout our county.
Stuff that we mentioned, creating more school counselors in schools as well. Maybe making sure that as people get through 10th grade, 12th grade, that really there's a lot of volunteers that also look like them and represent their communities.
I feel like it kind of makes sense.
It makes sense, yeah. I guess we could say that it's more talking that, like, generally speaking, men who are like these three categories generally feel better or safer in school.
As much as possible, bringing in young people to work with us because we feel like, hey, if we're going to focus on youth mental health, it's a good idea for us to be directly connected with young people. There's a lot of other things. It's not just, you know, me doing autopsies. There's all the people.
Camp as a teaching event and send your following questions, curiosity, email.
And to add, you can also
That'll be part of our welcome. Let people get settled in, grab their breakfast with refreshments, whatever, and we'll be in this space.
Thank you. Can you guys hear me okay again?
Yes, yes, yes.
Very good. Okay, I'll cue back up the slides. I'm close. All right, I think we're back at it. All right, so as I saw some questions pop in, that was awesome. So we had over 50 local youth express interest in this opportunity, and 31 ended up confirming and filling out all the appropriate permission forms and consents and that sort of thing. Ages, they ranged, vast majority were 16 to 18, but our age range was from 15 to 24. Most identified with using she, her pronouns, and majority were from those targeted geographical areas that we were talking about. So our South Seattle, South King County, which includes Auburn, Kent, Renton, White Center, Federal Way. We also had some from Bellevue and Shoreline. So yeah, I just wanted to share a little bit about that and a few other still photos to encapsulate our experience. But it's important to note that our young folks, they entered as participants and they departed as our very first cohort of public health ambassadors. And we had asked the 27, so 31 confirmed, 27 showed all 3 days. So we asked those 27 though to reflect on their time with us and offer us just one word. If you could summarize the 3 days into one word, what would that be? And here's those examples of the impact and the impression we made on those young people in one word. My hope is that a theme of co-creation has emerged, and this project would not have been possible without the support and the staff participation. Throughout the project planning, the execution, we hosted our 2 interns here who are pictured, Mariana and Kelly. They're both on the left-hand side of your screen. They completed their internship with us in September of last year, and they've now both begun grad school studies themselves. Mariana is studying environmental health at the University of Washington, and Kelly is completing her MPH at Oregon State University. But continuing the theme of creating opportunities for students, we proposed a program evaluation project to the University of Washington's DNP students. They have a project portal that allows practice partners like us to queue up our projects and match them with DNP students, and we were successfully matched with Lynn. And it is with tremendous awe and gratitude I turn the mic over to Lynn to help share her program evaluation. Thank you, Lynn.
All right. Thank you, Shayla. I hope I can be heard. So for my Doctor of Nursing program project or DNP project, I conducted the program evaluation of Public Health Camp, the pilot Public Health Camp at Public Health Seattle and King County. And this was a choice that truly excited me at the start as it aligned perfectly with my interests, as I'm also a public health nurse. So today I'll just share some highlights of my project, beginning with its background, purpose, implementation, evaluation outcomes, some findings, and then finish with some recommendations. So one of the central issues driving my project is a critical decline in the state and local public health workforce, which we may all be familiar with. Despite increased healthcare spending and economic growth, there has still been a significant decrease in workforce numbers since the Great Recession. And so this decline is compounded with urgent need for diversity within public health workforce, which is crucial for addressing the health disparities and tackling public health challenges effectively. And then with the COVID-19 pandemic, this only exacerbated these challenges, intensifying the need for a more robust public health workforce. And studies indicated that a substantial shortage of full-time equivalents, or FTE, for delivering essential public health services, reflecting pre-existing staffing issues in state and local health agencies. So even before the pandemic, these agencies were already operating with minimal staffing levels, raising concerns about their capacity to respond to public health crises. So to address these challenges, collaborative solutions were essential, and collaborative efforts between public health educators and practitioners are key to broadening the educational pipeline and developing effective strategies for workforce development and recruitment. Initiatives like the Public Health Camp exemplify this collaborative approach. And so the purpose of my DNP project that you see there was to evaluate the camp to guide its further development and pave way for its future growth. And through the evaluation, my aim was to provide insights that would support the program's expansion and also sustainability. We can go to the next slide. Thank you. I used 3 distinct evaluation frameworks. It's a lot, I know. But I wanted to continue with the pre-seed proceed framework since this was utilized in the planning, implementation, execution of the camp. But I focused more on the proceed part, phases 6 to 8, which are the evaluation process, impact and outcome evaluation. And then secondly, use the CDC framework for program evaluation, that blue circle that you see in the middle of the screen. This facilitated the interpretation and dissemination of my evaluation findings. And then lastly, in line with our shared commitment for diversity, equity, and inclusion, elements of the language justice framework was integrated to ensure a culturally responsive and equitable approach to evaluation, promoting diversity across all project aspects. And just quickly, language justice framework addresses language power dynamics, emphasizing language as a tool for transformative thinking and empowering action. It fosters trust and safety in multilingual spaces for community engagement, ensuring equitable access to all voices and perspectives. This approach aims to create a just and inclusive world through meaningful cross-community dialogue and transformation. Let me go to the next slide. So with the 3 hybrid frameworks guiding my project, the implementation process unfolded sequentially, as you see here on this slide. Starting first with the language justice principles. These were employed to assess planning and implementation materials, focusing on evaluating equitable access to all voices and perspectives. Next, the evaluation process was initiated with the first steps of the CDC framework for program evaluation, which encompassed identifying stakeholders, describing the program, focusing the evaluation design, and then gathering credible evidence. Subsequently, steps also involved providing a comprehensive description of the public health camp and aligning the evaluation design with the phases of the pre-seed proceed model. As I mentioned, the process, impact, and outcome evaluation. Additionally, a logic model was developed, or I developed a logic model to map out program theory and also the anticipated outcomes. It's a lot. But throughout the process, language justice principles were integrated into the data collection and analysis methods, which were done with the surveys and also document reviews. The CDC framework guided the justification of my conclusions, emphasizing the utilization of findings for program improvement and also identifying program strengths. The process culminated in a detailed evaluation report, over 70 pages, which included sections on background, purpose, evaluation, methods, results, discussion, and recommendations. Go to the next slide. So this is one of my favorite parts, outcomes. So what you have on the screen here is a snapshot of my DNP project poster. There are a lot of words, I apologize, and but I really like these words, and I hope you do too. So in evaluation, in my evaluation, various sources, as I mentioned, surveys, both from the students and also staff who participated in the camp, and reflections were reviewed. I'd like to share a powerful quote first from one of the participants highlighting the impact of the program. And you can read along with me, it's the top there. Learning about not only very interesting professions, but also specifically who these professions serve was very inspiring. This impacted me because now I want to aim to also serve people that are in more need than others may be. So this quote really, I think, captures the essence of the evaluation outcomes and the transformative power of the camp experience. So highlights from the student surveys, we'll move down to the boxes here. To the left, highlights from the student surveys noted in the box to the left include diverse participation with varied motivations, effective outreach through friends and teachers. I think Shayla had already mentioned that, keep sharing the word. A positive impact on interest in public health, and overwhelming satisfaction with 100% reporting extreme or very high satisfaction, and 96% likely to recommend the camp. In the other box to the right, that's staff surveys. I want to highlight the overwhelmingly positive response and high level of engagement, including staff enthusiasm, which are particularly notable. Unexpectedly, the camp played a crucial role in fostering workforce development. I love that. By offering a platform, this was a platform, again, for staff to both practice and teach valuable public health skills, share public health knowledge, and engage in networking opportunities, contributing significantly to their professional growth and overall engagement. I love a win-win. The planning, execution, and evaluation of the camp ended up aligning per my evaluation with the language justice principles, valuing all languages for inclusivity, integrating youth voices for empowerment, and establishing multilingual spaces to embrace every perspective, reinforcing inclusivity and justice. Shayla had shared some of the demographics. I wanted to share that there were also people who spoke various languages to include Korean, Vietnamese, Spanish, Tagalog, Somali, Amharic, Cantonese, Gujarati, Oromo, Swahili, Punjabi, and Hindi. So these folks were coming from varied backgrounds, speaking various languages. So I thought it was awesome that I used the language justice framework. Here to the next slide. All right, so really in this part, I know it says key findings, but I'm going to focus more on the recommendations. So to enhance the public health camp and ensure its continued success, want to share that it's going to take a multifaceted approach. First, starting with leveraging established public health training centers. I think Betty talked a little bit about this with some of the regional public health training centers that we have. We have that partnership with here UW, and this is crucial to continue the collaboration because this can facilitate development of targeted training programs aligned with essential public health skills, enhancing the effectiveness of recruitment programs like Public Health Camp, incorporating leadership programs for fostering effective public health leadership, promoting workforce recruitment and retention. And this looks like formal training, on-the-job training, mentorship, recognition of leadership potential. Tailoring recruitment efforts based on demographic considerations is paramount to address the unique needs and interests of diverse participants, as we've mentioned, meeting the participants where they are. And then based on also an inspiration from there's other education to career pipelines out there in the United States. So perhaps looking to them to build some other activities that they've used in their programs within PH Camp. And then based on surveys and feedback, diversifying session formats, strengthening career exploration, expanding outreach efforts, considering flexible session lengths, implementing continuous evaluation processes are imperative for ongoing improvement. Also possibly utilizing maybe a different framework when evaluating the camp at next iteration. If not, we can continue using the hybrid that I've used. Also the involvement of public health interns, Shayla has talked about this, and also the EES troop they significantly contributed to the camp's success through the program design, execution, strategic planning, and this just only emphasizes that we should sustain their involvement for continued success. Lastly, finish with something that is one of my favorites, especially in learning, is reflective writing. This is something that was done in the camp, and it's also can be used as a valuable tool for program assessment and continuous improvement. I'm gonna go to the next slide. All right, so because it's Thankful Thursday, quick shout out to my mom. It's her birthday today. Also, happy National Public Health Week for all of us, public health. We're all in public health, I think. So happy National Public Health Week. But I also want to share my thanks and would like to acknowledge all the ambassadors, camp staff, organizers, public health interns, Public Health Seattle and King County for their participation and hard work and dedication making this camp happen. It was my pleasure to evaluate this camp as a public health professional myself, who's also passionate about growing our field and also building interest in our youth to consider or pursue a career in public health. This leads me to also acknowledge the collaborative efforts fostered through partnerships within academic settings, working hand in hand with our community partners to cultivate mutually beneficial outcomes. It's been such a pleasure working with Shayla during my project and also getting to know Greg and being able to grow in my personal and professional network in this partnership. I mean, I'm super excited to see where Public Health Camp goes from here. And that concludes my part. And it back over to Shayla.
Shayla, we can't hear
Sorry,
you.
Shayla. Yeah.
Still can't hear you, Shayla.
While Shayla works on her sound, I just wanted to at least come on to say that everything that you've heard just really comes from the hearts and minds, and that the comments you heard from Lynn, just really exciting for me to just see that what we did was successful. And for me, more important, not only did the students benefit from this, but the adults in the room did as well. What we found is internally the morale from those who were involved, from the colleague standpoint, from the opportunity for those who have been able to create. She talked about the impact and the outcomes. Well, what they were was joy. And instead of us being here as FTEs and units and policymakers and government officials, what you heard and saw was mothers and fathers and brothers and sisters who came together and collectively really did accomplish our goal to make a positive difference through people. So thank you so much for allowing this opportunity to take place. And I think you're on now.
I think I figured it out.
Yes, there you go.
I'm so sorry. I'm in the office here with Greg, and we're trying to be mindful to not cause echo and stuff. And so, live and learn. So I wanted to just share where are we going next, and really, Lynn has given us such a gift, truly, to springboard off of. And we are right now, so save the dates for folks that are interested in taking part in this here in Public Health Seattle King County. August 5th through 9th, 2024 is our next activity. And I really think because our population health initiative and because folks gave this a chance, we were really able to do somewhat of a proof of concept. And our leadership here in Public Health Seattle King County said, wow, this was such an amazing activity. Let's try to find funding to offer this again. And so I'm proud to say that this year's activity will be funded through the CDC Public Health Infrastructure Grant. So this is a FIG activity for our other awardees that might be on the call. A really great way to use this opportunity of funding. We're getting ready to bring on 2 more interns to help us with executing year 2 of Public Health Camp. And I would just say the other thing that we're really trying to do is build out this ambassador community. Our goal is to really not have this kind of one and done 1 week experience. We're really wanting to build out, somewhat of that hub and spoke model, really spoke from this experience and create more opportunities throughout the year. And how can we tap into and really create a youth ambassador community. So with that, I want to just thank you, all of you. We'd love to see if there's a little bit of time. We went over a little bit, but I'll turn it back over to our host to see how we want to kind of close things out. Thank you so much.
Absolutely. Thank you so much, Lynn, Shayla, Greg, and Betty. This was a wonderful presentation. There are a handful of questions in the chat that we'll run through in the next 10 minutes or so. But I also encourage you, if you want to come off mute, just raise your hand and we will call on you. So feel free to do that as well. So I think the first question there's a lot of questions coming in the chat now. If you collected information from students on the impact on their desires for public health education or additional practice-based careers.
Do you want to answer that, Greg?
I'll just share this from the standpoint and then let the subject matter experts give some of the details. The students we found, they don't know enough to know what they don't know. They don't have exposure to what all this stuff is called science and technology. What is a King County and what am I doing in a public health? So this is a huge element for us to be able to create exposure and to allow them to obtain facts and data. And more important, as the motto expressed, allowing them to find and appreciate the power of you.
There's another question that asks if you can describe where you recruited the campers from, and if there's a web page for the camp that people can refer to.
Sorry, can you repeat that again?
Oh, there's a question about where you recruited, and then if there's a link to a web page that folks can visit.
Okay. So this is an area that we can definitely improve on, is our external sharing abilities. That is still in development. Now, if you're a part of our network or King County network, we can easily share, but yes, that would be, I guess, a next iteration would be, how can we externally share this with others? So thank you. Don't quite have that yet, but in the work, hopefully in our future.
But it has been a challenge in that the word of mouth has gotten out. And students now are coming to us and wanting to figure out how they can be a part of this opportunity. And so our 2024 challenge will be to just figure out how we're going to scale this down in terms of making it available without eliminating interest of folks, but also realizing we're limited to the number of seats that we have. But as Shayla mentioned, we have the Ambassadors Club. And so this is what's growing and should, again, be a part of this experience to sustain what we've started through the camp.
Cool. Ruby, I see you have your hand up.
Hi, everyone. Thank you so much. This overlaps with some of our mission and goals that for our program we're planning out. So thank you for your inspiration. Just a quick question with regards to student stipends. How much was it and what influence do you think it made?
Yeah, we did a $300 gift card stipend, and of course, using funds like this, it was a limited gift card, meaning at Best Buy or at Walmart, or it could not be used for tobacco or firearm purchases. It had restrictions in that way because we're using, we're a government entity giving out money, so we followed all of those rules. But the $300 is what we used, and we're continuing that same amount, even though you may have taken note that we expanded camp this year to 5 days. It's also not something we lead with. It is not on our flyer. You're not going to find that we are really, I would say, heavily marketing that there is an enrichment stipend. I think, frankly, because we don't want that to be the carrot that students are only pulling on. You know, we want it to be, again, that bolster and that enrichment versus the reason they're interested. And so it's kind of an after conversation, if that makes sense. You can find it once you go to our flyer, and I'm happy, actually, I could share, that is one thing I could share with you all, is our current public health camp flyer. So you could see how are we messaging this, and then what does our interest form look like. We have a QR code on there, so it's real low barrier for folks to just grab their phone and submit the form. And there is some buried details that tell you there's an enrichment stipend, but it's really, I don't know, I hope that answered your question, but I think that we're trying to be tactful or strategic a little bit about how we lead with that.
Thank you.
The inspiration that we have as well moving forward is that Dr. Betty Bekemeier mentioned a woman who's at the University of Washington, and she had a lot of isms that she had to face as a woman in a chair that's usually in a seat by a man, as a psychology major in a chair that usually is a seat held by a lawyer and accountant, as a LGBT part of the community, which is usually more of a non-LGBT seat, as a Latina, as well as being a part of the experience. She says she had a lot of isms and people called her a lot of things growing up, but she wants to connect with us and connect with the kids because they can call her whatever they want to call her, but they have to end it as the president of the University of Washington. And Anna Marie Casse, who Dr. Bekemeier had mentioned, has been a huge supporter of us as well. And we're looking to leverage her and her story to be able to allow her to serve as a role model to let other BIPOC students and folks facing the determinants of health with an equity lens. We can just bring facts and data and just bring hearts and minds to help know we can connect with and help develop and make a difference in the lives of others.
Great, thank you. This is a quick one. Lynn, there's a request in the chat. If you can provide a link to the language justice framework, that would be lovely. And then Ruby, I see you have your hand up. Go ahead.
Thanks for letting me ask the second question. Transportation is an issue for us, or we're considering transportation. Did you have any allowances for transportation?
Yes. So we didn't really highlight this. You may have saw in the video the thank you Metro little blurb and saw our participants getting on and off public transportation. But what we ended up being able to do is, under our One King County sort of mission, is we reached across our department and said, hey, King County Metro, you want to come help support this activity and be a part of this, you know, exposing youth to public health careers. And through that internal partnership, we were able to really get kind of a chartered Metro bus. We used our existing transit system, and you know, that's how we visited our sites and how we went out into community and out to where the work is happening is on those Metro buses. Now, we did mark it and say, if transportation is a barrier for you to get to and from camp, because our starting and stop point is in downtown Seattle, and recognizing we were outreaching South King County, like, oh, okay, we want all of you to come, but you have to come down here to downtown Seattle, right? So you're exactly right. We wanted to think about, let's not have transportation be a barrier. No students tapped into this option, but we did advertise that transportation is available to them. And what we were going to do, if it needed to be tapped into, was, again, using our local transit system and our transit centers, being able to set up our own schedule or our own kind of drop-off pickup schedule for public health campers using our existing transit system. Nobody ended up needing that, but we did build that out to really be a possibility so that we didn't have that barrier of getting to and from camp. So great question.
Great, wonderful. Unfortunately, we are getting close to time, so I'm just going to take the last couple of minutes to close out. So as we close out, I just wanted to leave you with a handful of resources that might be useful as you're exploring AHD partnerships. You can find the AHD learning community online, as well as the archives for all of our AHD webinar series. This webinar included, this one will be posted early next week, as well as other resources and tools related to AHD partnerships. For anyone who signed up for the learning community in registering for this webinar, you will be added to the group. And if you did not check that box and you are interested in joining the learning community, please just let me know. In addition, the Council on Linkages has an approximately monthly newsletter that regularly features the latest about the academic health department partnerships. If you're not currently subscribed, you can do so through the link on the slide, and I'll send that in a minute as when I stop sharing screen. So please feel free to explore these resources and let me know if you have any questions or if I can help you find anything specific. So with that, we would just like to thank you once again. If you're interested in participating in the AHD learning community, again, please just send me an email. We appreciate your participation in today's webinar and look forward to continuing the discussion. A PDF version of the slides will be posted to our website later today. And again, the recording of this webinar will be made available early next week. So thank you so much. Enjoy the rest of your day and have a lovely National Public Health Week.
Thanks, everybody.